The former president said he was seen by a doctor last week, quote, for a new finding of a prostate nodule after experiencing increasing urinary symptoms. Now, as bad as that sounds, doctors we spoke with tonight are optimistic. ABC 7 News reporter J.R. Stone joins me now live to discuss, and there's a lot to unpack here.
Yeah, I think we have to look at this as optimistic. And the fact that this is treatable, Dion, is certainly good to hear. It may not go away, according to those doctors that I spoke with, but things can be done, as I said, to treat it.
Former President Joe Biden has been diagnosed with prostate cancer, and now doctors are weighing in.
But I think what was surprising was his grade of cancer. It was described as an aggressive cancer.
In this case, what caught my attention is that it has spread outside the prostate, so that means it's more advanced. It also means, by definition, that it is generally incurable.
Dr. Arif Kamal is Chief Patient Officer of the American Cancer Society. Dr. Sandy Srinivas is a medical oncologist at Stanford. No one likes to hear the term incurable, but in Biden's case, both doctors agree that there are a number of treatment options.
The good news is that most people, even in their 80s, tolerate standard of care prostate cancer therapy pretty well.
Both Dr. Kamal and Dr. Srinivas say with the former president's more aggressive form of prostate cancer, pills or treatment that lower testosterone levels or make testosterone unavailable are likely to be used here.
So even though it's incurable, living another 4 or 5 years after a diagnosis like this wouldn't necessarily be out of the ordinary.
That's correct.
If it spreads and stays in the bones, generally doesn't cause a ton of trouble. Now, it can. But the good news is that unlike some other cancers that tend to go to some organs of the body that are a lot more critical, what we can do is give medications to strengthen the bones.
Dr. Kamal says the American Cancer Society recommends yearly PSA blood tests for most men starting at 50 and some starting at 45. Dr. Srinivas says there has been some controversy concerning those tests overdiagnosing patients and not being able to pick up prostate cancer in early stages.
So in this last decade, we do see a lot of patients like President Biden, where at their first presentation, they have disease that's already left the prostate and have spread elsewhere.
Former President Biden and his family are currently reviewing treatment options.
At this point, the former president has not said what treatment options he will undergo, but it's likely we'll hear more about that going forward. Dion, in his statement today, characterized one of those test results by a Gleason score of 9. A Gleason score goes up to 10. And I think the only reason that that was released was to show the severity here that we're dealing with.
I see. And let's talk about who should be the most concerned, because obviously I thought about my loved ones, those who happen to be older.
Two groups of people here. You've got to look at your family history. If you have a family history where this kind of cancer runs in that family, then you should be getting regular blood tests. The second thing you want to look at is, this hits the African-American population of men much greater than any other group out there.
Okay, certainly good information to have. I know we will probably be following up on this story in the coming days. JR, many thanks to you.